And we're back with Maya Franklin from the American Red Cross answering all your questions about giving blood because, of course, the holiday blood drive is coming up on December 14th. All right, this person's asking, if vaccinated, does donating blood reduce the vaccine quantity or protection in my system?
So our bodies are always working for us. And one of the things that happens when an individual receives a vaccine is that the antibodies are constantly replicating and reproducing. This helps us to protect our bodies so that that vaccine remains effective even if we've donated blood. Another factor to that is that we have about 5 liters of blood in our body at any given time, and we're only donating about a pint. So it is much less and not affecting the efficacy of the vaccine for those individuals who donate blood and have been vaccinated.
Right. It's not even like you're giving half the amount of blood that you have in your body. I mean, it really is a very small portion. All right. So if you're on medications, can you donate blood?
So there are certain medications that make a donor ineligible for blood donation. We ask individuals who are taking medications but want to give blood and may be concerned about their eligibility to call 1-800-RED CROSS. There they can ask an expert questions about the medications that they're taking, and they will know whether or not they're eligible before they present to donate.
You can find that online too, right? You can find a lot of that online too. Okay.
Yes, they can go to redcrossblood.org. There is a tab for eligibility. You can find a listing of a number of medications. Find the one that you're using on that list, and you will know if you're eligible. If you need more clarification, again, you can speak to someone directly by calling 1-800-RED-CROSS.
All right. Are they using antibodies from people's blood donations who've had COVID-19 to help those in need of treatment?
So around this time last year, we were actually collecting a product called convalescent plasma that was rich in antibodies of those individuals who had survived COVID-19. That is not something that we are collecting anymore. We stopped collecting convalescent plasma around the time that vaccines became available to the public. And convalescent plasma, honestly, was kind of a temporary solution. It's one of those things that the FDA allowed because there was not a vaccine available in the early days of the pandemic.
All right, but no longer anymore. Okay, can you give blood if you have had malaria?
So individuals who have been diagnosed with malaria would have to have had treatment, and then there's a 3-year deferral period. So if you have past that 3-year deferral period after your treatment, you would be eligible to donate blood. Those individuals who travel to malaria risk countries are also on a deferral period for blood donation once they return back to the States.
Okay. This person's asking, can I donate in someone's name that needs blood?
So you can certainly pledge to donate in honor of someone or in memory of a loved one who may have needed blood. However, your blood donation cannot be directly given to that individual. What happens when you donate blood is that it goes through a process to make sure that it is free of infectious diseases and healthy and safe for the recipient. So really, when an emergency happens, when a donor is in need of a transfusion, there's already blood on the shelf for them.
This person says, 38 years ago, I needed a blood transfusion. Can I donate now?
This is another question that would require the advice of your doctor, healthcare professional who you see regularly. Again, 1-800-RED CROSS is the number that we use frequently to determine donor eligibility, but really would want to seek the advice of your healthcare professional.
Do you find out your own blood type when donating blood? The answer is yes. I found out my blood type when I first donated at the holiday blood drive. This person's asking, if you get blood from a vaccinated person, will that vaccination be transferred to you?
No, the vaccination does not transfer to an individual. Along the same lines of the efficacy of the vaccine, whether or not it's effective after an individual gets blood, you're just giving so little that it doesn't make a difference through the blood donation process.
All right, and how old do you have to be to give blood?
You have to be 16 years old with parental consent. And there is no upper age limit as long as an individual is in good health.
Okay, and let's go along with those COVID protocols that people are going to experience when they come and give blood. And again, you can walk in or you can make an appointment online, but what should they be ready to see and do?
Yes, they should be wearing a mask. Be prepared to wear that mask for the duration of the blood donation process. They should see donor beds and other donor touch surfaces being wiped down with sanitizing wipes. They will notice that our phlebotomists are wearing gloves. They're changing gloves in between donors, and they're also using sterilized equipment to actually puncture an individual for the blood donation process.
Okay. All right. So you are going to be protected. And so if you have any other questions, they also have a list of all their protocols online as well. Maya, we're going to see you on Tuesday. Thank you for joining us today. If you missed any of this, you can find this information on our website under the Two Wants to Know section. And remember, WFMY News 2's 57th annual holiday blood drive is next Tuesday, December 14th, 7 a.m. to 7 p.m. at Piedmont Hall, which is right there in the Greensboro Coliseum complex.